Dilated cardiomyopathy in under 10 minutes. All right, let's jump right in. Let's minimize this, get it out of the way. Let's draw a very simplistic heart right here. Right there. Let's separate the chambers. Okay, perfect. So there we go. We're looking at the right side of the heart, left side of the heart. Let's get the eraser here. Let's erase where the problem is, which is in the left ventricle. Okay, good enough. Okay, so what is dilated cardiomyopathy? You have a ballooning or a dilation of that left ventricle. Okay, so let's minimize that. Let's bring it off to the side. So by definition, let's get the black back. Okay, so by definition, what are we looking at here? Definition is a heart muscle disease. So let's put heart muscle disease. Okay, moving on. So, what are some of the signs and symptoms to expect? Typically, these patients are going to present like a systolic heart failure. So, I'm going to put systolic heart failure. Which side, right or left? Either one, maybe even both. What does that mean? A left-sided heart failure, they're going to have some dyspnea, very common presentation. Right side, they may have some peripheral edema, some hepatomegaly, ascites, etc. You're going to see it all in these patients, especially if they've had it sustained for some time. Okay, let's talk about diagnosing these patients. Okay, so what's the most common thing and cheapest thing to do is probably a chest x-ray. What are you going to see on chest x-ray? You're probably going to see some cardiomegaly. Good. And if you can't do a EKG, you're probably just going to see like some sinus tachya, so that's not really clinically or test significant. But definitely the gold standard here is your echo. And what are you going to see in an echo? Exactly what you would expect to see. The left ventricle is going to be dilated. And how to differentiate this from hypertrophic cardiomyopathy is that the walls are thin. Walls will be thin. Okay, let's get that out of the way. Let's move on to the next section. So, how do we treat this? Well, as you can imagine, in order to treat it, you need to know what causes it. And actually, let's move that out of the way. Some of the most common causes, let's make note of those now. Some of the most common causes are bugs like Coxsackie, B to be specific, cocaine use, some alcohol use, even something called Takotsubo. Pregnancy can also cause this. Even after pregnancy, it could still happen. All right, so these are some common causes, and at the very end, I'll give you some ways, some neat tips and tricks that I use to remember this. So, as far as treatment goes now, how do you treat it? Well, if it's a drug that's causing it, then stop that drug. Stop offending drug. I'm just going to put offense. So, stop the offending drug. If it's pregnancy, then delivery of the baby may help with the symptoms. Pregnancy is a reversible cause of dilated cardiomyopathy, so are things like Takotsubo. All right, and we'll talk more about those at the very end. Moving, oh, actually, in regards to treatment, what if you stop the offending drug and you still have the typical presentation of heart failure? Then you're going to have to actually treat them like heart failure. And the treatment for me for that is A, B, C, D. And the A is you give an ACE inhibitor. B, you can give some beta blockers. C is not calcium channel blockers. You do not give calcium channel blockers to a systolic heart failure patient. So in this case, this is a cardiac transplant. Just going to put trans. And obviously that would be the last resort, but as far as keeping the alphabetical order, then it ends up mixed in the middle there. Either way, diuretics. Or you can even give digoxin, may play a role here as well. Okay. All right, so let's move on into some buzzwords, some things that help you remember some of this stuff on a test. So the first one is how to remember Coxsackie B being associated with it. I like to mess around with the spellings, and the way I spell it is Coxsackie. And right, Coxsackie B, and even the B could be for baggy, right? So Coxsackie. So right away I'm thinking of a saggy, baggy heart, right? Cocaine. As far as cocaine goes, if you've ever watched any movies in regards to cocaine, you've probably seen it inside of a little baggie of some sort, or they're bagging the cocaine. So I think of cocaine as a uh, baggy heart. And then alcohol, unfortunately, I don't have any way of remembering it that way, but I do associate cocaine and alcohol together, very commonly used. So I think of those. A night out of partying can lead to a very problematic heart condition. Another one is the Takatsubu. Let's draw very quickly what Takatsubu looks like. So in Japan, they use this little purse string, kind of looks like that. And basically what they do is they use this little pouch to capture small octopus that actually come inside to grab the food or whatever's in there. I'm not sure. And then they pull on the strings and they've captured the the octopus itself. So in this case, it's a baggie. So again, we associate Takatsubu with a baggy heart. And pregnancy. As far as pregnancy goes, I like to think of the belly as a baggy belly, and it's holding a baby. So it's just a mental picture, and I hope I don't offend any pregnant women. I don't mean any harm by this. But definitely, it does help me to remember, right? So anything to associate with baggy and a baggy heart for dilated cardiomyopathy. Okay, and lastly, let's look at some vignettes. Okay, two vignettes here. The first one says we got a 50-year-old male with a history of alcohol abuse. Okay, that's good. Complaining of worsening dyspnea. That's not really specific. Physical exam reveals bibasilar rales, elevated jugular venous pressure, S3, lower extremity edema. Pretty much the presentation of a heart failure. Chest x-ray reveals pulmonary congestion, cardiomegaly. Okay. EKG shows frequent ventricular ectopy. Echo shows left ventricular dilation and an ejection fraction of 30%. Which of the following is the most likely diagnosis in this patient? And, well, dilated cardiomyopathy would be your better answer choice here. Could it be D as in dog, Takatsubu? A left ventricular dilation, yes, but the history on this patient would be different. So we would look at a patient who's probably been married 40, 50 years, just lost their husband or wife, their spouse, and now they're presenting with this heart failure presentation. Right, so in this case, dilated cardiomyopathy would be the better answer choice. Let's take a look at one more vignette. You are evaluating a patient who complains of worsening orthopnea and dyspnea on exertion. He admits to drinking. Oh, let's get rid of this. Drinking Beer, lots of beer, a nightly basis for about 20 years. Physical exam shows laterally displaced PMI. Audible rails, S3 on auscultation. Echo shows dilated left ventricle. Ejection fraction is 35. Which of the following is the most appropriate counseling to slow the progression? Well, in this case, we have to identify what is causing this patient's dilated cardiomyopathy. It's probably the alcohol, so always stop the offending drug first. Thank you.